Hello, family, friends, and fellow prosperers. Welcome back to my second YouTube video dealing with all things autoimmune from actual patient's perspective. Today, I'm going to delve into how I was officially diagnosed with an autoimmune disease called myositis. Myositis is rare and it is chronic. In my case, it is hereditary. My mom died at age 63 out of the blue with this disease, but it has come a long way with opportunities for individuals who are diagnosed to be treated. And back then, they didn't have all of the treatment that they have now. It was just put under a category of rare disease. It's still in the category of rare disease, but there are hospitals now doing a lot of research like Johns Hopkins, Cleveland Clinic, the Ohio State University. I'm actually in one of those hospitals' myositis clinic, and they only take 6 patients, and I'm one of the 6, so I am very thankful for that. But how did I get diagnosed? First of all, I'm thankful that my diagnosis came sooner than later. Now that I've gotten a lot of information, sometimes it takes 2-3 years for individuals to be diagnosed. And as I look back, I had symptoms easily 10-12 years ago. So in my case, I started getting really weak in my lower extremities, my legs, my thighs, just a little weakness in my arms. I modified what I was doing because I thought that it was my workout regimen, because I'm usually in the gym 5 to 6 days a week. I enjoy it. And so it was just hard for me to walk a long ways. I had to lift my legs up to get in the car. I could not walk up steps at all, even in my home. It took me a long time. I was literally pulling myself up the steps. And so then I had 2 falls. And when I had 2 falls, I said, something's not right. And my mind immediately went back to the symptoms my mom had when she died all of a sudden out of the blue. And I went to my family doctor, shout out to Dr. Colleen Smith, and she took it seriously because she knows that I try to live a healthy lifestyle. I don't, usually when she wants to prescribe something like, oh, do you want pain medication for something, this, that, and the other? And I'm like, no, I don't want it. So she took my symptoms and what I was telling her really seriously. She did a lot of blood work. She said, we're going to go wide first and then we'll hone in. But she said, I'm going to take, you're going to take this series of blood tests. So based off of the symptoms I told her that I was having. And so I live about 20-25 minutes from my doctor's office, well, where I had to get the blood test at. And so after that, I was going into the city. I live in a rural area, and I was going into the city, and I got a call. She told me it would take 2 or 3 days, and I got a call that same day, and she said, I want you to go immediately to the emergency room. I will call before you. You need to have your kidneys flushed. I said, my kidneys flushed? I said, I don't feel that bad. And she said, well, I just got back the results from, I checked your CK level, and they're over 5,000. And I believe it's under 100. And I will verify that for you, Prosperous, what a normal range is for your CK levels. And so she also told me that my liver enzymes were way up, probably compatible to how my CK was. So of course I'm getting worried, but at the same time I'm halfway going to get my flowers because I wanted my flowers, live flowers, so I could plant them. I said, Dr. Smith, I'm almost in the city. I need to pick up my flowers. And she said, okay, do that, but don't pass go. I want to see you in this emergency room because you need to get your kidneys flushed. And I didn't know what that meant. Mind you, I've always lived a healthy lifestyle. So I'm thinking, what is this? I knew it was serious. And so they hooked me up to an IV and pretty much put the fluid that I think is common. They put fluid through me to flush my kidneys out, and that really didn't do anything. And so she's like, okay, I'm going to send you to a rheumatologist, and I'm going to send you to a neurologist because it seems like something's going on nerve-wise. At that time, we were still just investigating. And that's when my tentacles came up, and I thought, I have to be my own advocate. I have to be my own advocate. I don't know what's going on here. And so I went online like we do. I don't know if that's good or bad, and just started saying elevated CK, elevated liver enzymes. And so I was looking that up, and I went through a slew. And when I say a slew of different tests, and each one was probably a month apart. It's just really hard, at least in the United States, to get specialists. So I did get in with the rheumatologist quickly because she personally called her, and I was able to get in with that test. Then, and I started dealing with 2 different hospitals when they were thinking autoimmune. And of course, they test for everything. They test for MS, they test for lupus, they test for just a slew of things. Some things I had never heard of, but at least 5 or 6 different autoimmune diseases. And then myositis was one of them, and I got some positive enzymes from those. And then from those, I had to take more tests to see if it actually was myositis. And so that contains a biopsy where they have to go in deep enough in your muscle to check your muscle enzymes to see if you have elevated proteins. And then from there, they, in our case, and I live in a really large city, in Ohio, the hospitals don't have the capacity to test for it. There's another small children's hospital. Well, I shouldn't say small, it's a research hospital. There's only one person in our city that tests for it, and that's at a children's hospital. So what that entailed was them doing the biopsy, which they have to go deep enough and then wide enough. So I have a 2-inch scar, and they get it, and then they have to pack it in something cold, and then they send a courier out to make sure that they get it in time enough. And so after they did that, that was another wait. In the meantime, I had an opportunity to see the neurologist, and so that they did some type of nerve technique, but it came down to it was positive for myositis. Of course, I had never heard of it, and when I think of myo, I think of, and I believe that means muscle weakness. I'm thinking of the heart, because that's what you heard a lot about during COVID, but it has nothing to do with that. So then that's it. By that time, I'm already 6 months, 7 months deep into trying to figure out what's going on. In the meantime, they give me prednisone because, you know, that's the go-to drug for everything. And it didn't do anything. And when I say anything, but of course you get all of the inflammation, the puffiness, but I wasn't worried about that because I was trying to get well, and I was hoping that the prednisone would get me well, but it didn't move the needle at all. And I'm thinking, wow. And in the meantime, I'm getting weaker, and on top of that, I'm getting a lot of inflammation. Inflammation is one of those elements that's across all autoimmune diseases that I'm aware of, and from my research, that inflammation is across all of the autoimmune disease, or I'm going to say most. But So in the meantime, I'm getting weaker. I'm getting a lot of inflammation, and it's not working. And they increase the prednisone, and it still doesn't work. So once I got my official diagnosis, after that, my rheumatologist said, hey, we got your results back, and it is indeed myositis. Now, myositis has different categories. And one day I'll do another video on the different categories. But I have necrotizing myopathy, which means that I call it a subvariant. So in addition to all the things that come along with myositis, I have the type that my muscle dies. So with intervention, I'm doing better, because one of the things that they tell me is that muscle can regenerate itself. And it's so important for you to make sure that you have lots of movement, and then you'll have new muscle. And so one of the things I want to talk about is all of the doctors that you have to see, and the diagnostic and the blood tests in between. I went from just going to my annual to now, listen, at least 2 to 3 times a month, I am going to, and probably every week, I'm going to some kind of doctor. So the number of doctors that you have to see on a regular basis if you have myositis, and I wrote this down because I didn't want to forget, is you have your hepatologist dealing with your liver. And I saw the liver doctor a lot on because they wanted to distinguish if my myositis or my autoimmune disease, if I needed to do a liver biopsy. And she determined, it was a female, that she didn't want to do that biopsy because it was invasive if we didn't have to. And we didn't have to. So there's a hepatologist for the liver. There's a nephrologist for the kidney. There's a rheumatologist for the inflammation and all things autoimmune disease. There's a neurologist because it does affect the nerves in your legs and also in your arms. There is a physical therapist because it's so important for you to continue to move. The optometrist because it does affect your eyes. You have your primary doctor. And then on top of that, you have to get blood tests, at least in the beginning, the first year, at least twice a month in my case, because of any of the medication that they give you could throw things off, or they really just want to monitor the medicine that they are giving you. And I am so grateful for that. And in my case, I just can't go to my doctor to have the blood test or to my local urgent care. I have to actually go to the hospital because it has to be cold spun. I still don't know what that means, but whatever it is, they have machinery at the hospital that they don't have at most of your local offices, doctor's offices, or your urgent care, which is, in my case, really close to my house. So I have to drive in twice a month to make sure that my blood is drawn so that they can do their diagnostic work and make sure that everything is in sync, or if there are some areas that are elevated, that they can jump on it quickly. So I'm grateful that I have a wonderful medical team, but I am seeing a doctor, or I am going to get diagnostic testing at least once a week. And so it's funny because when I got my treatment and now they know me by name, I told them, I don't know if that's good or bad. So you have to see so many doctors, but I did get my diagnosis in about 8 months, which I thought took a long time, but from what I'm hearing, that's a short time frame. Once you get diagnosed, then you can start medication. And usually from the meetings that I have attended, because there is a Myositis Association, and they give so much information that you can do, well, I shouldn't say do, that your rheumatologist or your neurologist can prescribe oral chemo, methotrexate. A lot of people with arthritis, I'm learning, take that as well. You can do immunotherapy. A lot of cancer patients take that, but I take the IVIG hemoglobin infusions that I am actually admitted to the hospital either 2 consecutive days per month, or 1 day per month to get my therapies at the hospital. And so what that means is that, well, let me tell you the difference between chemotherapy and hemoglobin infusions. With chemotherapy, they're killing something that is causing inflammation and causing your disease to erupt. With immunotherapy, they are putting in enzymes and putting in my case, it's a blood product that will help you get better. That's a process in and of itself, because I got turned down, even though my doctor thought that it was the right thing to do. She documented everything. She knew this was going to help me, but my insurance company turned me down the first time and said that I had to take the oral chemo. So once I did that, and it actually made me sick, she actually requested again that I take, that I be a candidate for the IVIG hemoglobin infusions. They did honor what the doctor wanted to prescribe and thought that that was best for me, and that has worked well. It's starting to work really good. Some myositis patients are on multiple layered medications. Right now, I am so thankful I'm only on that. I've weaned myself totally off of the steroids, and so I get those treatments once a month. The downside is that you have to physically go in, be admitted, and be in the hospital once a month. And that's a turnoff for a lot of patients. They don't want to be, if they may want to go to the Riviera and take a cruise, and they don't have to worry about always, well, when is my infusion date? But on the opposite side, the IVIG hemoglobin infusions are the only FDA-approved medication for myositis. That's the only one that's approved. So my goal is to eventually, through diet and exercise, to wean myself totally off. I don't know if that'll ever happen, so I'm glad you're on this journey. Some doctors have told me that that's not going to happen. My body is always going to fight against itself. But others have said they know patients who have weaned themselves off. So my goal is, in connection to everything I'm doing now, is to make sure that diet and exercise possibly can have me wean off. I don't know, only God knows, but I'm prospering where I am at this point in time, and I'm glad that you are going along on my journey. So if you have any questions, let me know. Anything I've said that you want clarification on, or just continue to take this journey with me and live life and all things beautiful so that we can prosper together. All right, bye-bye.